Hey guys, Dr. Bar here, a bariatric surgeon in Dallas, Texas, and today I want to talk to you about the preparation leading up to surgery. Sometimes patients can be surprised that it can take weeks to months to complete all of the things that need to happen before you can even get bariatric surgery. So today I want to break that down and talk about what actually is happening in that time period. First, a disclaimer. The tasks to complete before surgery can vary greatly depending on your doctor and your insurance company's requirements. So this is a general overview based on how we do things at my practice. So most insurance companies require active participation in a weight management program or documentation that you've tried to lose weight before. Some policies want something as intense as monthly documentation of this program for a year, and others require as little as documentation by your doctor at the time of your consultation. Next is a mental health appointment. Not because there's anything wrong, but to be sure that you understand that you're making a permanent change to your body and that you understand fully what that means so that you'll be successful long term. Next are dietitian visits. They will go over the pre-op, post-op, and lifelong diet changes that you can expect after surgery. These appointments are the things that usually take the longest to complete because some plans require only one and others require up to 12 times over the course of a year. Next, at our office, we require a cardiology workup to make sure your heart is healthy enough for surgery. A lot of times, patients with obesity can have high blood pressure or high cholesterol, which can put strain on the heart. So it's important that if you're undergoing anesthesia, that your heart is healthy enough for surgery. Next is a sleep apnea assessment. This is to make sure your breathing is as healthy as possible. Patients with obesity can have chronically low oxygen levels or high carbon dioxide levels due to the long-term trouble with breathing at night. By getting you on the correct treatment beforehand, it makes the surgery safer and makes sure that you won't have to stay on a breathing machine longer than intended. And finally, some type of imaging of the esophagus and abdomen. This is a look for possible issues to address before or at the time of surgery. Finding out that you have issues swallowing or a hiatal hernia or acid reflux can change which surgery you're a candidate for. So having that workup helps us make the best decision possible for your care. I know that seems like a lot, and the time it takes before surgery pretty much depends on how fast you can get all this workup done. But I promise, each part of the workup is about safety and making you successful in the long run. Thanks for watching, and if you have a question about bariatric surgery or things that I haven't gotten to yet, drop a comment below.